how do we just give everybody this amazing, we know what consumer experiences are. We have Amazon Prime, we have, Uber, we have, so what if we bring the best tech into healthcare? And I would say that was Simple Health Kit's vision of being a platform that's end to end. We can screen people for different conditions, connect them to a care so they're not dropped off, like left hanging, and just kind of do this in a way that's seamless and easy for us. But then we decided to go power it to enterprise partners. So we sell to health insurances, health systems, pharma, retail pharmacy, and strategic partnerships where we believe that we can grow if we just have to work together and partner together. So we love partnerships to where we can reach people that need care the most. I was just making sure I got the stats for chronic kidney disease. They say 1 in 7 have CKD.
Wow, really?
Wow. 9 out of 10 don't know.
Is that just America or is that
America? US adults, about 35.5 million people are estimated to have CKD. As many as 9 in 10 adults with CKD do not know they have it.
Whoa!
Wow.
So imagine,
what is it? Is it a simple treatment for that? If you know you have it, is that something that's easily fixed?
CKD stage 1, CKD stage 2. But yeah, there's so much intervention in the early stages. But once you go down that line, you're in dialysis, and I see dialysis centers over.
Yeah, it's too late.
Yeah.
Wow. Everybody get tested.
If you think of America, 80% of people are pre-diabetic or diabetic.
80%?
Yeah, the last stat I said diabetes. And remember, it can be, let me get that, 80%.
That's a big number. I knew it was bad. Had no idea it was that bad.
It's pretty bad. Yeah, the stats are pretty astonishing. Even with chronic kidney disease, it's something that if you could detect it early, it's curable. But if it's too late, and most of the time, a lot of these, you don't have any symptoms, and it could be just too late. So we are actually in the business of and remember, for the health insurance, they don't want to, they don't want us to have chemo and dialysis and all of this. So there's an incentive.
It's expensive.
Yeah. So for the first time, prevention is top of mind, which I love, that we are now deploying these screenings.
And big question in this country these days, what about people without insurance? Because a lot of it's covered by insurance, but you're also available direct to consumer if people don't have insurance. What kind of cost? Is it totally depends on what kind of screening you need, or is there kind of a standard price for them?
We specifically designed it to be affordable. So you can get the doctor visit, the telehealth visit, everything. Like, for example, I think the common STD is under $70, but you're getting a doctor visit, you're screening for 3 tests, you're getting all of that in the comfort of your home versus, going somewhere, then waiting in an appointment, and then paying the medical and bill and your copays. And so you
less than $100 for some. Yeah, I mean, you can't ask for much better than that for medical procedures these days.
Yeah, no surprise bills. So I discovered a novel protein looking at the genetic code, and
novel protein. Okay, tell me what is that exactly?
It's our body's made of proteins. We have DNA, and so I discovered a novel tRNA methylation enzyme, and people like, what is that? And then it was on the genetic code. I had to convince my professor, Dr. John Perona. It's like, I'll learn about biochemistry, and I believe this could be, what we think it is. It has a tRNA binding domain and so forth. And so he was like, okay, and ended up learning everything about biochemistry and proving that it was what we predicted computationally.
You discover a new piece of what makes up humans that we didn't know about before. That's what the novel means, right? Like we didn't know about it before.
Yeah, novel means like new, something.
Right. Okay.
It's pretty wild.
Piece of information, and then, now we know what it is. And then, so it was really a cool experience. So post my PhD, went to the Silicon Valley, been building, all my life now. My last company, I led product where we used a smartphone. It could help detect if women had preeclampsia or gestational diabetes with protein in the urine. So I'm very passionate about women's health. I know you are too, Heather.
We are too, yeah.
Yeah, it's mostly what we're about here.
Yeah, exactly. And so it was first of its kind. It could take a photo, it would do machine learning and would say, okay, this person has high protein in the urine, is at risk. We went to the FDA, got the product cleared, first of its kind. And then the company got acquired and the product unfortunately never made it to the US market. That was, I know. However, I did keep some of those friends really close and they said like, hey, let's go do this at scale. Let's go do this at population level and make this technology, this platform accessible to people that need healthcare the most.
Thanks for joining us on the Healthcare Uprising. Make sure to hit those like and subscribe buttons before you go, and take a moment to think of a friend and hit that share button. You can find us on all the major audio platforms, and we've got video on YouTube if you want to watch us in action.
You can also find us on social media on LinkedIn, TikTok, and Instagram. Just search Healthcare Uprising to find us. And if you're a new company with a cool new product, if you're someone innovating alternative methods for the health and wellness space, or if you have a personal healthcare journey you'd like to share with us here at The Uprising, please email us at healthcareuprising@gmail.com. And we'll get back to you about coming on the show. Well, that's all for this dose of Healthcare Uprising. Until the next time, keep looking for the good in the world, because sometimes it's where you least expect it.
We are not doctors and we don't play one on TV. If you need medical advice, consult with your physician or a healthcare professional. This has been a Shut Up production.